I'm very excited that as we announced on Sunday, the Kenyan textile industry has risen up to the task and is currently able to produce as many masks as we require. We have capacity from local industries, at least what I have assurance from the material we currently have in stock among our fabric manufacturers is sufficient to make 60 million masks immediately. And we have instructed them to get in touch with their distribution chains and make this available to even tailors and other people in the villages so that we can expand our capacity as quickly as possible. Have capacity that has been confirmed and we'll be distributing it over the next couple of days, and I'm certain by today we actually have at least 1 million masks available, and I'm certain that they are already in the distribution channels. This is a 3-ply mask which can be utilized by the health professionals. But it is also good for you. So when you go out to buy, ensure that you can detect that it has got 3 plies. There's one inner layer, an outer layer. The darker part is the outer layer for gathering dust, but there will be a filter inside it. So that is something that medical personnel can wear, but also all of us can wear. I think these 3 are all alike. There may be just a simple dust mask that can be worn by everybody, including our border riders, just for dust purposes, and it will be made out of woven cloth, but that is not going to protect you against disease. It may protect you against dust and other particles in the air, but it will not protect you against disease because it doesn't have the inner filter.
In the last 24 hours, we have managed to test a total of 362 samples, out of which 12 people have tested positive for coronavirus disease. Out of this number, 11 are Kenyans and 1 Somali national. This now brings the total number of those who have tested positive for the disease in the country to 122. I am saddened to inform you that we have lost another patient to the coronavirus disease. The person, a 6-year-old male child, who was also ailing from other medical conditions and had been admitted to Kenyatta National Hospital. This now brings to 4 the number of those who have died as a result of this disease. We have now started manufacturing personal protective equipment and masks for health workers and for initial distribution to boda, tuk-tuk, and matatu operators. In our efforts to boost the capacity in our counties, I urge for continued collaboration between members of county assemblies and governors during this period. This collaboration should foster accountability measures and ensure expediency in the procurement of services for our people, especially in our county hospitals.
Based on our calculations, that is about 25 to 30% of the cases that we have so far are local transmission. Local transmission occurs in forms of clusters. And these clusters, if they are not controlled, then they merge into bigger clusters, what is the so-called snowballing effect. And that is why we are really very, very firm on contact tracing to be able to ensure that if you have any evidence of local transmission, then we go down to the area where this has been reported, make an appropriate contact tracing process to be able to ensure that everybody is brought on board. Regarding the 6-year-old who died in Kenyatta National Hospital, of course, the necessary infection prevention control measures have been put in place, including quarantining of the staff that handled this particular deceased child. We have also been in contact with Kenyatta to ensure that that particular place has been disinfected and all those patients moved elsewhere. We are in the process, of course, of testing them because people who are in ICU, in terms of risk profile, they are at a very high risk of contracting COVID. And therefore, we shall be able to monitor them within the necessary time period. We shall be able to deploy our testing regimen to be able to find out whether they've been infected or not, and based on that, be able to take appropriate measures. In terms of the distribution, of course, it is now we're having pockets all over. And I think we have a list we can be able to share with you from all the way from the coast to the western part of the country. And unless we take these measures that we have been talking about seriously, then we'll have more and more pockets. But if we highlight and practice the infection prevention control measures that we have highlighted, we practice social distancing, then we can be able to quickly reverse or extinguish these local transmissions and bring to a stop